Hello viewers, welcome to another health video. Today we are going to learn about 8 causes of blood in your stool. Before we get into the details, please do like and subscribe to my channel. Do share this video if you think that someone else can get benefited from this. Let us see the signs of trouble. You may notice blood in the bowel. The color can range from bright red to almost dark, and the shade offers clues to what is going on. Rectal bleeding can be a symptom of many conditions. Some serious, others are less serious. It can signal a problem anywhere in your digestive tract, from your esophagus to your anus and points in between. Let us learn 8 possible reasons for the blood. The first reason is hemorrhoids. Hemorrhoids is the most common cause of rectal bleeding, usually the type that stains the toilet paper. It happens when veins in your anus and rectum swell. Some of the many causes are obesity, pregnancy, and straining during bowel movements. It's not an emergency. Along with bleeding, hemorrhoids cause itching, pain, and irritation. If you add fiber to your diet, drink more water, avoid sitting for long periods, and get more exercise, your condition may improve. Over-the-counter creams could bring relief too. And Kapalbhati Pranayam is a must-do thing for improving digestion. The second reason is anal fissures. These are small tears in the skin around the anus, usually caused by constipation and hard stools. Along with bright red color, you might notice pain during bowel movements and afterward. You can add more fiber to your diet or take stool softener to ease the problem. A warm bath might help too. If it does not get better, your doctor can give you a cream to soothe the area. The third reason is polyps. Benign growths in your colon don't usually cause bleeding during bowel movements, but it is possible and can happen slowly over time. Other symptoms include changes in the color of your stool and changes in your bowel habits that last longer than a week or two. Polyps can turn into cancer, so it is key to find and remove them before they do. Make sure you know when it is time to get a colonoscopy or other cancer screening tests. The fourth reason could be colorectal cancer. Blood can be a sign of a tumor in your colon or rectum. You might see bloody streaks in your poop or notice that it is dark colored, a sign of bleeding higher up in your digestive system. Often though, you can't see blood on your own, but your doctor may find traces of it with a screening test. Other colorectal cancer symptoms include diarrhea or constipation, belly pain or cramps, bowel movements that are narrow, and fatigue. You will need surgery and possibly chemotherapy or radiation to treat this condition. The fifth reason is inflammatory bowel disease. This condition includes Crohn's disease, which is inflammation in any part of your digestive tract, and ulcerative colitis, which is inflammation in your colon and rectum. Both can cause blood during bowel movements, pain, weight loss, and diarrhea. Your treatment will focus on lowering inflammation, pain relief, and controlling diarrhea. Usually, medicines and changes to your diet and other habits can make a difference, but some people will need a surgery. The sixth reason is diverticulosis. Diverticulosis means that small pouches form in the walls of your intestines. When one of them gets infected, you have diverticulitis. Other than blood on toilet paper or in the bowel, symptoms can include cramps, fever, nausea, changes in your bathroom habits, diarrhea, or constipation. Antibiotics and a change in diet might solve your problem, but if your case is severe, you might need a surgery. The seventh reason is peptic ulcers. These open sores in the lining of your stomach and intestines can cause dark blood to show up in your poop, but it does not happen to most people with ulcers. The most common symptom is pain. You also might have heartburn, burp a lot, or feel nauseated. Treatment can include antibiotics and medicine to block acid. You may need to limit your use of non-steroidal anti-inflammatory drugs since they can be hard on your stomach. The eighth reason is esophagus problems. The tube that connects your throat to your stomach can be the source of blood that ends up in your stool. A common cause is GERD, expanded as gastroesophageal reflux disease. Another possible problem is a tear in this tissue, which happens mostly to people who regularly drink too much alcohol. People who have liver disease can get swollen veins in this area, which may bleed. GERD treatment can include drugs to limit acid. Other conditions might require a surgical procedure. So what should we do when we see blood in the bowel? If you see a bit of bright red blood when you have a bowel movement, you may have relatively minor problem. It is important to note any other symptoms you have and check with your doctor if you suspect a problem like colon cancer. Maroon or tarry stool are often a sign of more serious issue that you should deal with right away. If you see a lot of blood, feel lightheaded, or your heartbeat is fast, get emergency help.
Thank you so much for watching. Please like and share this video. For more interesting videos, subscribe to my channel. Thank you.